Okay, so this is our last lecture on new material. So this is our final. It's very small, the amount that we have left to do. After we finish this, Friday is your exam 3, which is also pretty short. And then after that, for the remaining time, we'll work on your final project together. I'll decide if we'll meet in person or meet virtually, because it's not like super important that you're there. Okay, so this is the last bit of wrist and hand. I'm just going to go over some of the muscles that I think are important to know. So these are the muscles we're going to do: the palmaris longus, extensor digitorum, flexor digitorum superficialis, flexor digitorum profundus, and then we're going to generalize in flexor group and extensor group. So there are way more muscles in that forearm that control the wrist and hand, but for the purposes of your class, I don't think you need to learn all of them because they are more specialized. So I just want you to know these main ones. But just so you know, there are more muscles in the forearm than what I'm talking about. So flexor group versus extensor group. So we commonly know that the flexors in the arm are going to be on the anterior side. The extensors are going to be on the posterior side. So the flexor group is basically going to be all the anterior forearm muscles, and they share a common origin point of that medial epicondyle on the humerus. So sharing to this bump right here. So remember when I talked about that medial epicondylitis was from all the flexor groups pulling on that bone. While the extensor group is going to be kind of all the muscles on the posterior forearm, and they're going to share a common origin point on that lateral epicondyle of the humerus. So on the smaller, less pointy side. So that's what causes that lateral epicondylitis. So if you ever are having to identify and you don't really know what it does, figure out if it's on the anterior side, figure out if it's on the posterior side, and then you should at least be able to figure out flexion or extension. Okay. So first specific muscle I'm going to pull out is going to be the palmaris longus. So the origin is going to be that medial epicondyle. So is it going to be on the anterior side or the posterior side? If it has an origin site of the medial epicondyle. Anterior, because we know the anterior muscles, flexor group, share common origin of the medial epicondyle. It is going to insert into your palmar fascia. So basically in your palm, you have a kind of area that is just fascia, so just connective tissue, has no contractility. So it's not connecting straight onto a bone. Now this does wrist flexion. So what I want you guys all to do is do thumb opposition, which you should know from last time is this. Now you're going to flex your wrist up. See how I have that little cord poking out? Anybody not have that? So you should see like this cord going straight down. Probably can't because you're watching. So that is your palmaris longus. So when you do that, you can pop your palmaris longus out and it will be visible. Some people either don't have a palmaris longus, so when they do that, nothing comes out, or their palmaris longus is actually sitting deeper than it normally should. So everything else is on top instead of it sitting the most superficial, so that's how you're able to get it to pop out. So that is palmaris longus. Okay, so flexor digitorum should sound familiar because that was in the toes. But flexor digitorum superficialis is specifically in the hand. So the flexor digitorum superficialis origin is going to be the same common flexor tendon coming off that medial epicondyle. It's going to come off that coronoid process, which we know is that the front of the C in the ulna, and it's going to come off of the radius. So we can see it's coming off of medial epicondyle, this front of the C, and the radius. It is going to insert onto the sides of the middle phalanx of 2 through 5. So it's not going all the way to the tips of the fingers. It's coming to that middle aspect on either side. It is going to flex the MCP, so your main knuckle, and it's going to flex the PIP, which is this knuckle. It does not flex the very tip of your finger. So it's only going to flex the 2 joints of your fingers, not all 3. So then, to get, because obviously you can bend all 3, you're going to have your flexor digitorum profundus. So the flexor digitorum profundus is going to originate on the upper 3/4 of the ulna, so basically the very top of the ulna. It is going to insert onto the distal phalanx of fingers 2 through 5. So that is what's going to get all the way to the top. It is going to flex your MCP, so metacarpal phalangeal, your PIP, and your DIP. So flexor digitorum profundus does all 3. So if we have a flexor, we're going to have an extensor. So again, extensor digitorum should sound very familiar. It is an extensor group, so therefore it's going to originate on that lateral epicondyle of the humerus. It is going to insert on the base of the distal phalanxes of 2 through 5, so it's going to go all the way to the tip. It's going to extend that first knuckle, MCP, extend PIP, and extend DIP. So you notice, again, all of these are not going to the thumb. The thumb has its own muscles. Instead of digitorum, it would say pollicis, because it is the pollex. But there are way too many thumb muscles. That is too specialized for you guys to know. Okay, that's actually it. So that will be all for basically all the material you need to learn for this semester. So you will have your exam on Friday. I do want you to start thinking about what you'd like to do your final project on, which basically your final project is going to be, you can do it in like groups of 2 to 3, or if you want, you can do it by yourself, because I hate group projects. You will be taking a sport-specific movement, and I'll talk more about it as well. I'll show you some examples. And you're going to break it down in phases. And then you are going to list what every single joint is doing in every single phase, and every single muscle that is doing that joint movement in every single phase. So we will work on it together. So I will post some stuff that you can consider and think about, and then in our next class I will talk more about, and you can kind of pick what you want to do, and then we'll go through and kind of show you. We have some worksheets to do as well to help you, guide you through it, because people usually struggle on this and will get bad grades. So that is it. Exam on Friday.